Miss Scarlett, a 45-year-old female, a single actress who lives alone in an apartment in Sydney, visited the ED due to palpitations. The ED nurse noted that there is swelling on Miss Scarlett's neck. There is also noticeable protruding of eyeballs and mild tremors of patient's fingers. The patient also stated that she had lost some weight recently, and after her vital signs were taken, the patient is tachycardic with a heart rate of 110 beats per minute with an irregular rhythm noted. Her blood pressure is 140 over 90 millimeters mercury. The temperature is 37.1 degrees Celsius and a respiratory rate of 26 breaths per minute. The ED doctor ordered some blood tests, and it was noted that the patient had the following lab results.
Thyroid is a butterfly-shaped gland that sits on top of the trachea or windpipe. It's made up of the right thyroid lobe as well as the left thyroid lobe, and they're connected by the isthmus or the centerpiece. Occasionally, there's a finger of tissue called the pyramidal lobe that extends towards the head. The thyroid creates thyroid hormone, which helps regulate your metabolism.
Graves' disease is the most common cause of hyperthyroidism, an autoimmune disorder that causes the thyroid gland to overproduce thyroid hormones. It's hard to pinpoint the exact cause of Graves' disease, but researchers are still investigating what triggers this autoimmune response. Here's what we know about what happened to the immune system in Graves' disease. The pathophysiologic mechanism is that the immune system creates antibodies called thyroid-stimulating immunoglobulins. Now, these TSI attach themselves to thyroid cell receptors called the docking stations for TSH. Now, these antibodies imitate the function of TSH. Therefore, TSI trick the thyroid gland to overproduce thyroid hormone, high levels that are more than what the body needs. With increased levels of T3 and T4, hypothalamus will initiate negative feedback mechanism and tries to signal anterior pituitary gland to secrete little to no amounts of thyroid-stimulating hormone as compensatory mechanism. With increased levels of T3 and T4 in the blood, the signs and symptoms are presented. First one, increased metabolism in cells, therefore causing heat intolerance, weight loss, tachycardia and increased blood pressure, mild tremors of fingers, irritability and restlessness. Second one is the thyroid-stimulating immunoglobulins circulating in the blood will bind to tissues in the eyeballs, causing inflammation of the eye muscles and thereby this called Graves' orbitopathy or Graves' ophthalmopathy, the presenting sign of Graves' disease. And the third one is overactive thyroid glands causing the neck to be swollen, and this is called diffuse thyrotoxic goiter.
There are two treatment options for hyperthyroidism. Medical options include antithyroid drugs like methimazole and propylthiouracil, and radioactive iodine treatment, which both interferes with the thyroid gland's ability to produce its hormones. The diagram on the left shows the action of antithyroid drugs, while the diagram on the right shows the process of radioactive iodine treatment. As nurses, we need to make sure that Scarlett is well taken care of as she stays in the hospital. To do this, adequate rest should be provided by keeping a cool and quiet environment. Her weight must also be obtained daily for comparison and assessment, as well as her dietary intake. Administration of oral antithyroid drugs while documenting her progress and any undue reactions is a must. This is to ensure patient safety and provide her doctor actual information that can be used in the course of treatment. Letting the patient verbalize her feelings or frustration can also help improve her self-esteem and well-being.